Hi guys, it's Med by Health Hush. In today's video, we'll be speaking about acute appendicitis. Usually, we see many patients which comes with acute abdominal pain, and if you see the most common reason behind this acute abdominal pain is acute appendicitis. So let's see what acute appendicitis means. It basically means inflammation of the appendix, which can be of two variants: obstructive type or non-obstructive type. And if you see, usually this inflammation can be caused due to different reasons, but the most common reason is infections. And the pathogens which can cause this acute appendicitis include most common ones include streptococcus, staphylococcus, intestinal parasites. And how do they go and infect this appendix? It can be by several ways. Usually, we know that microflora resides inside the intestine, in the lumen. So these microbes can also cause this infection, and also there can be infections, bacteria or other parasites, usually bacteria, which will come through the hematogenic ways, and also lymphogenic ways is more commonly seen in women. So if you see the two variants, which is obstructive and non-obstructive types, with the name itself you can understand obstructive is something obstructing the lumen of the appendix, which can be caused due to several reasons. Here we see the sources of obstruction, which include first feces, parasites, growths, which can result in clogging the lumen. And obviously, if the outflow of the mucus which is produced inside the appendix is unable to move out and do clearance, there are bacteria inside, and this will cause a overgrowth of these bacteria, which can infiltrate to the wall of the appendix and cause inflammation, and which will later on result into more severe complications. And also there can be obstruction due to enlarged lymph nodes on the appendical wall, which can be caused due to GIT tract infections, gastrointestinal tract infections. And these enlarged lymph nodes will compress the lumen, they will narrow the lumen by obstructing the outflow of the stuff which are located in the appendix. And also another reason includes inflammatory bowel disease, uh, which can be of two diseases: Crohn's diseases and ulcerative colitis. And also another reason is abdominal trauma. So if you see the classification of acute appendicitis, before that we should go and discuss about what is non-obstructive type. Non-obstructive type is there is inflammation of the appendix, but this inflammation is located or limited to the mucous membrane of the appendix, just located or limited in the mucous membrane, and it does not go beyond this. So this will resolve by themselves, or most of the cases they will progress into ulceration, suppuration, fibrosis, and gangrene. And also another classification of acute appendicitis include appendiceal colic, simple superficial appendicitis, destructive appendicitis, which can be of three types: phlegmonous, gangrenous, and perforated. And also we have complicated appendicitis. Complicated appendicitis basically means appendicitis along with its complications, which means it includes appendicular infiltrate, appendicular abscess, diffuse purulent peritonitis. So I will little bit more explain how this will happen. So as I said, bacteria resides and they multiply usually due to obstruction and less clearance in this area, and they will infiltrate the appendix wall. Once they infiltrate, they damage the wall, and it can result in two things: abscess formation or peritonitis. So if this damaging of the wall uh, becomes like a full thickness of the wall being damaged, and formation of the leak, causing passing of the contents which are present inside the appendix to the peritoneum, this will result in a diffuse purulent peritonitis, inflammation of the peritoneum. And other complications include pyelophthitis, sepsis, retroperitoneal phlegm, um, local abscess of the abdominal cavity. That means it can not just located near the appendix, but it can be in some uh, different area with formation of abscess. So if we speak about some several specific signs for acute appendicitis, we have a few. The first is Rosen sign. Usually in Rosen sign, we do deep palpation starting from the left iliac region, going through the descending colon to the transverse colon, and then to the ascending colon. Usually, when we go halfway in this region, in this pathway, we can see the patient starts to have a right iliac region pain. Usually, why did this happen is because once we do deep palpation, we'll be pushing the contents which are located in this lumen to go and backflow and get accumulated in the ileocecal valve, near the ileocecal valve, where the appendix is located. So once these contents go behind and irritates the appendix, this will cause pain in this region for the patient if they have acute appendicitis. Next, we also do this maneuver to find whether the patient is having positive Passois sign. We ask the patient to lie on his or her left side and do extension of the hip. If this causes pain, that means this sign is positive. Next is obturator sign. In this case, we ask the patient to flex the hip, do flexion of the hip. This will cause pain, and if this happens, it means positive obturator sign. And guys, I forgot to mention in this, to find this obturator sign, we should ask the patient to flex the hip and also to do internal rotation. So if this causes pain, we consider it as a positive obturator sign. And also there can be Dumphy sign, which means the patient is having right iliac region pain when they cough. And Rosenstein sign is when the patient lies on their left side, they will have pain at the right iliac region. Next include Bartholomew-Michelson sign. This means like when they lie in supine position, they don't have much severe pains in the right iliac region, but once they lie on their left side, they have increase in pain in the right iliac region. Next include Blumberg sign, or also known as rebound tenderness, which means we do deep palpation over the suspected inflamed area for appendicitis, and then we do sudden release of this pressure which we created, and this will cause very severe pain in this region. And this sign is also present if the patient is having peritonitis, which is a complication of acute appendicitis. So if you see diagnosis, let's zoom in. So diagnosis usually done by a score which is known as Alvarado score, and in this score it includes several signs and symptoms which we give a mark to each, and then we calculate a total to do our diagnosis. So if the patient is first of all having migration of pain, we give 1 mark. Anorexia, nausea also we give score like this. And also presence of tenderness in the right lower quadrant, presence of rebound pain, elevated temperature, and also leukocytosis, more than 10,000 white blood cells, and also shift of white blood cell count to the left, uh, with more than 75% of neutrophils presenting. So usually maximum score that can be present here is 10. And let's see how we do the diagnosis. So usually if the total score of this patient is 1 to 4, it's not a very severe condition or a condition which we need to be worried about, so we can just discharge the patient. And if the patient is having score 5 to 6, that means we should admit the patient and also observe the patient for a few days to see how it goes. And if the patient is having 7 to 10, we usually do surgery, which is appendectomy and removing of the appendix. Uh, so to remember these signs in the Alvarado score, we have a mnemonic, which is mantrals, M for migration of pain, A for anorexia, N for nausea, T for tenderness in the right lower quadrant, R for rebound pain, and E for elevated temperature, L for leukocytosis, S for shifting of white blood cell count to the left. And also, if you see the types of surgeries which we can do, we can we have two types, which is open appendectomy and laparoscopic appendectomy. Usually, open appendectomy is done in patients which have very severe complicated versions of appendicitis with peritonitis, which we then have to like wash the peritoneum. So we do open appendectomy on them. And if they have simply not very severe situations, then we go for laparoscopic appendectomy. So that's it. I hope you guys enjoyed. Thank you.